welcome to the first episode of this podcast. This is going to be about medicine, the pathway to become a doctor, the revision techniques and key things you can do during school to maximize your grades and the UCAT score to be able to get into medical school. And then once you're in medical school, what to do, how to do your dissertations, how to do your OSCE exams, and then your foundation training. So this is going to be a bit of everything. Right now, I'm currently going into year 13. So I'll tell you my journey as it goes on. You can also find the latest information about me on my TikTok, shunts_medicine. So starting off, if you're thinking about becoming a doctor, you've got to really want it. It's not just a thing, oh, I want the title, oh, I want to get loads of money. Being a doctor means much more than that. Because, in true honesty, in the UK, doctors don't get paid as much as other countries, so they don't do it for the money. And I don't think any doctor does it for the title. It's a really hard work to become a doctor. So, you need to truly want that career. You want to help other people. So, where can you start? Well, it all starts with GCSEs. So, when you're in secondary school, GCSEs is your starting point to becoming a doctor. You want to make sure that you can get high enough grades in your GCSEs so that you're able to take at least chemistry at A level and preferably one other STEM subject because that's what most universities require. So that would be biology, physics, maths, or English, but I think they prefer a science or a maths. Once you get your GCSE grades, depending on where you're going, which college you're going to, which sixth form you're going to, make sure you've met the entry requirements in grades. And like I said, chemistry is a requirement to study medicine, so you need to make sure that you've picked chemistry as one of your choices. And then a STEM subject as your second one, which, as I said, could be biology, physics, maths. I personally have chosen biology, so I do chemistry, biology. And then the third one could be anything of your choosing that you know you're good at and that you can get a high grade in. Unlike what most people say, you don't need to take maths to study medicine. You don't need to take maths at A level. I take biology, chemistry, and religious studies, and I'm on my way to hopefully studying medicine. So you don't just need to pick maths, but you could pick maths. It would be an advantage. It would help you out in your chemistry and say your biology or your physics, but you're not forced to pick maths. So if you're like me and you're not too strong with your maths, and you don't think you would do well if you picked it at A level standard, then you don't need to, and you can still become a doctor without it. So moving on to like university application. So if you're now in A level and you've decided medicine is the career for you and you're sure, you should already have been doing, but especially in year 12, start doing lots of extracurricular stuff that you can put on your personal statement. So the best ones for medicine is getting work experience in a hospital, which I know not many people can get. But just work experience in a healthcare setting would work. So whether that be a care home or a pharmacy, if they allow you, then that's good as well. Me personally, in year 10, my school ran a work experience week, so I done a week in a pharmacy, and then the same thing in year 12, which I luckily done a week in Chase Farm Hospital surgical wards, which I was very grateful for that. I know not many people can get a work experience like that, so universities don't expect you to have work experience in an actual hospital. I just got lucky with mine, but that's not a requirement. As long as you do work experience in a healthcare setting, that's all you need. Something healthcare related that you can reflect upon and talk about on your personal statement. As well as this, volunteering is very good to have. Like, for me personally, I volunteered in Barnet Hospital, helping out some UCL students with their OSCE exams, which was pretty cool, pretty surreal experience. Um, I also helped younger students read that weren't as strong with their reading. I helped them read and taught them techniques on how to better their reading. So things like that. You can do little things like even helping out younger students, but like make it a weekly thing or a monthly thing at least, so that you can put on your personal statement and say, look, I dedicated my time to volunteer for this place or for the students in my school or for this or for that. And I've reflected on it, and this is what I learned from it. This is what I took from it. And this is what the skills that I'm going to take from it that I'm going to use in medicine and in university to become a better doctor. So, yeah, that's the volunteering and the work experience side of things. Now, the grades, I think most universities, if not all for medicine, the lowest grade you'll find without extenuating circumstances is 3A's. But say you do have extenuating circumstances, which is something like you're a carer or your household is under a certain amount of like income, or the place that you live in doesn't have much people going to university, then you could get reduced offers from universities for medicine. So I have seen a few that's like AAB, it goes down to. I think there's one that goes all the way down to 3Bs. But for the like top universities like the UCL, the King's, the Cambridge, the Oxford, I think they usually lower their UCAT score rather than their grade requirements, most of the time at least. So moving on to that then, the UCAT. So the UCAT, what is it? So the UCAT is some people call it an IQ test. I like to call it it's just a mental challenge. So what the UCAT actually is split up into different sections. From I think from 2025 they removed a section called abstract to reasoning. So the different subtests that are remaining, verbal reasoning is your first one that you do, because you do all of these in order in the test. It's a 2 hour long test. First one's verbal reasoning. This one is your English side of it. It makes me think of English language when I do it. It's like you get given a text, you get told to answer some questions related to the text, and you get 22 minutes total for verbal reasoning. There's 44 questions, so that gives you about 30 seconds per question. So luckily, each question is not on a different passage. There are 11 passages with 4 questions each, making the 44 questions. And with verbal reasoning, they don't expect you to be able to finish the test because of the times. Usually, most people don't finish the test. At least I don't know anyone that has, but everyone that I know is not able to finish the test because of the short timing. So the technique going into verbal reasoning is, let's skip a few of them. Let's skip the hardest ones. We've got 11 passages of text. What if we skip 3? Come back to that at the end, maybe guess it if we have to, but make sure the rest of the ones that we are doing are done well. Because now we've got a bit more time to do them. Let's make sure we get all the marks on the rest of them. That's the technique that I use. I don't know if it would work for everyone, because everyone's different, obviously. So it might not work for you, but you should try it out. Doesn't hurt to try it out. See if that would work for you for verbal reasoning. But other than that, there's nothing really you can revise for verbal reasoning except your skills. Just practice your reading skills, like read newspaper articles online on scientific breakthroughs or politics, because they can ask a whole range of stuff from economics, history, politics, science. So just read up on your news, practice your reading skills if you need to, and your like try pick out the right key information from a text. Like there's skill trainers and stuff that you can do for that. Um, Specifically on Medify or MedEntry, which are the two main UCAT revision websites. I use MedEntry personally, but it's personal preference. But they've both got skill trainers on there to practice your reading skills, practice your keyword scanning. So just do those, practice loads of questions, subtests, mocks, and then you should be fine for that. It's just about your timing, get it done quick. And your strategy as well, like I said, skip a few of the hard ones and then guess those ones if you have to. But yeah, moving on to the next subtest is called decision making. So this one is my personal favorite because I really like the types of questions on here. This is your logical puzzles, your riddles. I like to call them riddles, but they're called syllogisms, which are these types of questions that say, I don't know, all whales are blue, all fish in the sea are different colors. How many whales are in the sea? It's something like that. It sounds like a riddle, but you just need to get your head around it. So decision making, I said, is logical puzzles. It's got 37 minutes for 35 questions. So this is the most time you get per question out of all of the subtests. You get just over a minute, so about 63 seconds per question. And the questions can range from what I just said, those are riddle type questions, to Venn diagrams, to probability questions. So there's a bit of maths, a bit of logic. There's there's a bit of a mix. It's a bit of a mix. I personally like it because there's these question syllogisms and there's these other ones which are worth 2 marks for 5 answers. So you get a text of passage like the riddle one, or you get this text of passage with um like a scenario like, should we tax the richest people in society to benefit the poor? And then that one is a 1 marker where you get 5 options of which one is the strongest argument. But then you could get a whole text of passage that talks about the economics between two industries, and then it gives you 5 yes or no boxes that you have to answer from that text of passage. Similar to the syllogisms, you get that riddle and you get 5 ticks of yes or no questions to answer from the syllogism. So the syllogisms, you get 5 yes or no boxes for the text. So it might say, are all blue whales fish? So it might say, all blue whales are fish. So you have to put yes or no. And then if you get 4 right, you get 1 mark. If you get all of them right, you get 2 marks. So me personally, for decision making, I like to focus on those 2 markers because I feel like I'm getting more money um for the time that I'm spending. I'm getting 2 marks per question if you get it right. But again, this one's about strategy. If you see a hard question that you know is going to take you a long time to do, skip that one, flag it, and come back to it. Flagging is this thing on the UCAT where you can press Control or Alt F, depending on the keyboard, and then it flags that question. So then when you get to the review bit at the end, you can go back to the questions that you flagged and try do them again if you've got time, or guess them. So the next subtest is called quantitative reasoning. Now, this is like your proper maths type of subtest. Every question's maths related. You got stuff like probability again, if you're unlucky, because you already got the probability from decision making, so you shouldn't get too much from the quantitative reasoning. But it's more other stuff like time zones. Like when I say time zones, I mean it will say this person has took a plane to this country at this time in at their home local time. What time would they get to the other country at their local time? And then it gives you a bunch of clocks with what the time is between each country, and then you got to work out the time difference, and then add it to the time of add the time of the flight to the time that it would be there when they first got on the plane. And those ones are a bit fun. There's also these currency questions that I really like, which is it tells you, oh yeah, this is the I don't know, Swiss francs exchange rate to British pounds. How many pounds can you get for 3,000 Swiss francs if you converted it back? Or how many pounds can you get for 2,000 Egyptian pounds? So it's these types of exchange questions that they're pretty fun. I personally think they're very interesting. But again, in time conditions, it can feel a bit overwhelming sometimes, depending on how hard the question is that you get. So it just really depends. But again, with quantitative reasoning, which is a thing that's present in like the whole UCAT except for the situational judgment, if you see a really hard question that you know is going to take a long time, skip that one, flag it, and do that one at the end. Okay, so the fourth and final one. So those three subtests um, that I just mentioned, those are going to form your cognitive score, which is that score that the universities will see. So it's out of 2,700. I know that the UCLs and the Kings want around 2,200, 2,100. I know there's other ones that are a bit lower, like Brighton and Sussex Medical School want 1,990. There's probably some universities that want lower than that. There's some that don't even have a cutoff on the UCAT score. So you just got to apply strategically depending on your UCAT score, or if you really want to retake the UCAT the following year, because you can only do it once per year. But this fourth one, situational judgment, forms its own type of grade system. So there's four bands. It's put in a band system. So band four is the one that you don't want to be getting, because I think nearly all medical universities just reject a band four in situational judgment. But anything else, band three, band two, band one should be fine. But you want to aim for those top ones because it's all your ethics side of medicine. So as long as you know the key medical pillars given by the General Medical Council, you should be fine. You can watch probably for all of these, you can watch YouTubers online that go through different question types and different subtests, different skills, and show you how they do it. Like I know there's a guy called I think Joel George on YouTube, and he's really good. I personally use him to learn skills for my UCAT and learn how to do questions. So there's guys like that on YouTube or girls that teach you how to do each question. So now that you've gotten your UCAT grades, you've gotten your score, you got a good score. End of year 12 exam, you done well in your tests. You got at least three A's in all your tests. You've done your volunteering, you've done your work experience, you've done your essay competitions, you've done all this stuff. Now, what do you do? Well, now you got to actually fill out your application, which includes your personal statement. So, your application, it's on a website called UCAS. UCAS, you better get to know UCAS because you're going to have to know it well. This UCAS is going to determine where you're going to go for university. So, first of all, you got to fill out your information, which you should get done whenever you can, as soon as possible. Fill out your where you live, your birthday, your parents, if you've got any circumstances, and then you get to the optional bits, which is the 5 choices of university you want to pick. So that's up to you, and what degree, what course you want to do. Well, depending on what predicted grades you've got from your end of year 12 mocks, but you choose, and then you also have to put in a personal statement. So, personal statement, what is it? This is a big text of writing that you have to write and you have to perfect, that will get sent off to the universities when you're applying to the university. And if you've got the grades, you've met everything, they want to read your personal statement. Who is this guy? Let's see what is he about? What is he gonna benefit our university with? So they read your personal statement, they see, oh, nice work experience. Oh, he's reflected on that. That's good. Oh, volunteering. Very nice. Oh, essay competitions. Good. And then they think, okay, this guy's a good candidate. Let's invite him for an interview. So before we get to the interviews, there's 5 options of universities you can pick, 5 degrees. Medicine is usually a similar course, I think, for nearly every university. But there is like different types of medicine courses you could do. Like there's a postgraduate one, which is after you finish a different degree, you can do a postgraduate in medicine. I don't know the other types, but there's probably more types. But the standard medical degree is your 5 year degree where you have to do hospital clinical training. I know for like Cambridge, they only do clinical training by year 4. But the ones that I want to apply for, like the UCL, the Kings, they do it from day one. If you get lucky, that your university might have cadaver dissection, which are donated bodies from people that have recently passed away. Um, for medical research, they donate their bodies, and you cut them open, see the different organs and the anatomy, and learn from it, and be thankful for that person. I know UCL, Kings, Brighton, and Sussex all have cadaver dissections, but I don't know about any other school. So you've got this done now. You've got your application done. So now you've been invited for an interview. So for medical interviews, they're gonna test you. They want to see, see how good this guy knows his stuff. So they might ask you ethical questions. Oh, what do you think about this? The state of the NHS right now. What do you think we can improve? If you were in this scenario with this type of patient, what would you do? Or I think a lot of medical interviews also give you actual questions that you have to answer to the best of your ability and then answer it to their face. So if you get it wrong, it's a bit awkward. But they don't expect you to get everything right because that's the whole point. You're going to the university to learn these things, but they want to see how you think and they want to see your personality. So as long as you've got good personality and you're able to think, which I think you should be able to after completing that UCAT well and getting A's in your test, then you should be fine with your interviews. Interviews, if you get to that stage, you're lucky, and you got better make sure you don't lose that opportunity because you've gotten that far. You can do it. So then finally, you got on your interview. You've gotten an offer from the university you wanted. The thing's not over yet, though. It's not over yet. Now you need to get those grades that you've promised them you'll get in your final A levels. So if that's a 3A offer, you got to get 3A's in your final A level to get the offer. I know this all can sound a bit overwhelming, a bit like, how am I meant to do all of this? Who do they think I am? I'm not a superhuman. But it's doable. People have done it before, which means you can do it. If one person was able to do it in the past, anyone can do it. As long as it's not impossible, which it's not. So you just gotta have faith, and you gotta have the will, and you gotta have the dog in you to be able to push through and do well. But you gotta really want to do this. Like I say, again, medicine, you really want to help people. You're not just doing it for the money. You shouldn't be doing it for the title. If you're gonna do this long process that's gonna last probably a quarter of your life, maybe, you really want to do it for the job. You want to do it because you love the job, not because you want money, not because you want a title. If this is what you want to do, this is all you would want to do. There's no doubt in your mind. You gotta be straight and be like to yourself, this is what I want to do in my life. I'm going to work so hard to get there and become a doctor and help people because I want to help people. I'm not doing it because I want to show off or I want to have loads of money, because most doctors don't even get a lot of money in this country. Um, I want to do it for the patients, for the families, giving them more time to be with each other. That's why you should choose medicine. So, I hope you liked this first episode. This was more of an introduction episode, more like how do you get into the medical career and how does it all work. So, I would talk about foundation training and stuff, but I think that's a bit out of my expertise because I don't want to get anything wrong. But once I get to that stage, hopefully, I can talk to you about the process and how to do it and all the good stuff. So I hope you enjoyed this. Tell me what you want me to talk about in the future. If you've got any specific things, I can maybe go over it. Put it in the comments. But I will be going through some recent medical breakthroughs, which will be useful in your interviews, your medical interviews that you should know about, and NHS hot topics. So stay tuned for that, and thank you for listening.